and welcome to the in-depth series of Drishti IAS. My name is Pooja Dwivedi. The Ministry of Social Justice and Empowerment has come up with a strategy to prevent suicide for the next certain amount of years. It will be included in such a manner that it is a time-bound suicide prevention strategy. We are going to talk about it only from the perspective of prelims as well as from the perspective of GS mains paper 2nd and 3rd. It is important for us to understand, as well as 4th. It is important for us to understand the analysis. So these are the many things that we are going to take into consideration while we cover this topic. National Suicide Prevention Strategy is the first of its kind strategy in a country like India. It wants to implement action plans in a timely manner. It has a timeline provided for it. And there are going to be multi-sector collaborators, because not only one ministry but different collaborators are going to ensure that such suicidal thoughts that occurs into the mind of the people of India is not there. And of course, if it is there, it is mitigated. Okay, it wants to reduce the suicide mortality by 10% by the year 2030. This is a straight preliminary fact, and it is based on WHO's Southeast Asia region strategy for suicide prevention. Let's move ahead and talk about the objectives. It wants to establish effective surveillance mechanism for suicide within the next 3 years. That means it wants to monitor what are the reasons for suicide and how to mitigate them. It will also establish psychiatric outpatient departments, and this will provide the suicide prevention services. So who will provide suicide prevention services? Psychiatric outpatient departments. It will be implemented with the district mental health program in all the districts within how many years? Within 5 years. And it will also provide an mental well-being curriculum to be provided in the all educational institutes within the next 8 years. So there are 4 principles: 1st, 2nd, 3rd, and this one is 4th. 4th one is what? Very importantly, whenever we get news of any suicide, for example, let me cite the example of Sushant Singh Rajput's case. When he committed suicide, it was sensationalized, his privacy was desiccated, and there were issues with respect to how the suicide was presented in the media just to create a huge TRP for themselves. They started, abusing the ethical guidelines that they are provided when it comes to, telecasting suicide matters. So, guidelines will also be developed for the responsible media reporting whenever it comes to suicide telecasting of cases of suicide. Okay, what kind of information should be provided, which target population should not be included in this. Okay, now let's talk about suicides in India. When we see it, it's pretty sad that more than 1 lakh lives are lost every year in India due to suicides. It is top killer in the 15 to 29 years of age, and as you can see, suicide 34% if we see, it goes in the 18 to 30 years of age. Then there are also 30 to 45 years of age, it is 31%. Plus 60 category, it is just 9%. Still, it is higher than what 0 to 18 years of age go through. From 2019 to 2022, the suicide rate has increased from 10.2% to 11.3%. Okay, per 1 lakh population. This could also be attributed to coronavirus inflicted issues. Accidental deaths and suicides report in India in 2021 has been published by National Crime Records Bureau. This brings the report, and it has seen that there are rising suicide cases with respect to daily wage workers. That means the social parameter, if we see, a lot of pressure is there on laborers and daily wage workers, and it is increasing. Moving ahead, if we talk about the sector-wise, you can see a lot many percentage share in total suicides in 2021 can be seen from the daily wage earners. Of course, professional and salaried person, it is 9.7. Daily wage, it is 25.6%. Then we talk about housewives, it's 14.1%. Then we talk about students, it's 8%. And if we talk about persons engaged in the farming sector, it is 6.6%. Then we also discuss unemployment in an employed person, it is 8.4%. So this is the sector-wise breakdown. Then if we have to talk about other important data, 33.2% suicides are attributed to family problems which are other than marriage-related problems. 4.8% marriage-related, 18.6% is illness. Maharashtra tops in states with respect to the highest record of registered suicide. Then comes Tamil Nadu, and then Madhya Pradesh. In Union Territories, Delhi tops the chart with 2,840 suicides recorded. Now, if we talk about the data around the world, an estimated 703,000 people die by suicide worldwide. Over 1 in every 100 deaths in 2019 were the result of suicide. Global suicide rate is over twice as high among men than women. Globally, suicide is the 4th leading cause of death, globally I'm talking about, in 15 to 29 years of age. Over 3/4, 77% that is, of the global suicide in 2019 occurred in low and middle income countries, but the highest age standardized suicide rate, that is 10.9 per 1 lakh, is within high income countries. Approximately 1/5 of all suicides are the results of pesticide ingestion that comes from rural agricultural sector, and hanging and fire are also common modes of committing suicide. Suicide remains illegal in over 20 countries, which has further raised issues with respect to what kind of stigma we put on those who are committing suicide. They need help, medical help, they need medical attention and the mitigation of whatever thoughts they are having, but instead they are punished for having such thoughts. Then who is at risk? First of all, the risk has been well established between mental health and suicide, and financial problems, relationship breakup or chronic pain and illness are among other very risky areas from which people commit suicide. Also, it is seen that people who are experiencing conflict that is related to war, disaster, violence, abuse or loss, and a sense of isolation is also there. Those people also commit suicide. And it is high among those who are in the vulnerable groups such as LGBTQ, transgender, women, the SCs, STs, and those who have previously attempted suicide. They have a high risk of again committing suicide. So these people are at risk. What needs to be done? We have to have a multi-pronged approach. First, we have to ensure that economic support by strengthening household is there, so that money or financial problems does not become the issue. And also strengthening access and delivery of suicide care. Insurance policy should cover it. Apart from that, there is also a reason to include mental health in the insurance policies. Apart from that, we should ensure that the access and availability of help, it is very comforting, it is not stigmatizing, and it is available. Also, create protective environments, especially if we talk about the schools, colleges, as well as among the family and group. It is important that we understand that it is important to talk about your feelings and important to talk about negative emotions so that we can address it. Also, to promote correctedness, teach coping and problem solving skill and not ending life. And also identify and support the people who are at risk. That can only be possible when interaction is there. If you're not interacting, then of course you can never understand which people are at risk. Implementation strategy flows from top to bottom. How? Ministry of Health and Family Welfare, the Government of India will work through Secretary and DGHs. Okay, DGHs, as I told you in the beginning only, it has already undertaken National Mental Health Program. Then District Mental Health Program is implemented by this only, which will be provided in district hospital, community helpline centers, PHCs and HWGs as well. There are also multiple collaborators, as you see, who are going to work parallelly. Okay. Apart from that, Secretary is also going to be there, which will get the data from NIMHANS and Center of Excellence in Mental Health, and Department of Health, Principal Secretary of Health and Mission Director of National Health Mission will also get involved. There are many stakeholders here. Now let's talk about other initiatives that have been undertaken. Specifically, if we talk about Mental Health Care Act of 2017, it takes into account the importance of mental health. Then we have Kiran, which is a 24/7 toll-free helpline number provided to those who are having any sort of issues with anxiety, stress, depression, suicidal thoughts and other mental health condition. It is provided by Ministry of Social Justice and Empowerment only. We also have Manu Darpan initiative, which was started by Ministry of Education during the COVID-19 pandemic under Atmanirbhar Bharat Abhiyan only, to provide psychosocial support to students, family members and teachers for their mental health that was impacted by COVID-19. First of all, in the way forward, it starts from your house. We have to acknowledge negative emotions and not just positive ones. Instead of saying don't cry or boys don't cry, why are you crying like a girl, just encourage crying, because suppressing it is the worst thing that you can do. And it is important to communicate at the family level what is wrong and how to solve it. Apart from that, the broader political, economic and socio-cultural factors play a very important role. The social factors encourage certain group of sexes to cry, such as girls, but not the others. Why? Why not cry? Crying is a very natural biological emotion. If you can be happy, you can also cry. There is nothing wrong with crying. Just understanding and being aware of what is wrong and then solving it, it is going to be a lot better instead of just oppressing and suppressing emotions. Then we also have to ensure that mental illness or calling somebody crazy, retarded, it is just stigmatizing and perpetuating what we as a generation felt was wrong. So it is important that we encourage them if they are having some sort of mental issues. Everybody's mental health, totters one day or the other. It's nothing, it's nothing to be ashamed of. Just we have to destigmatize it. Don't call people retarded, crazy, or just for the sake of fun. Also, don't do that. It's important that we, as a generation, the current generation is very aware of this fact. Okay, and then we have to destigmatize it, and then we also have to ensure that they get the help at the correct time. Okay, so that's it. Thank you so much for watching. Stay updated.